We have time, dietary, nutritional, neuroendocrine aspects, and then, okay, this is just, these slides, you can just read them, I won't go over them, they're just summary of the literature that, and the facts that we know about chronic Lyme disease in terms of antibody testing, in terms of unreliability of tests, and also the diagnosis. Rash isn't always present, tick bite isn't always ascertained. CDC criteria was set up for public surveillance for NIH testing, not for diagnosis, but it was weighted over the diagnosis. As we said, CFS findings are only positive in Lyme, probably 9 to 30% of cases if you go through the studies. I found this article when I was looking about in psoriasis, the dermatologists have a study where they treat with Zithromax for 48 weeks and get 80% improvement, yet if we treat more than a lot of us 4 weeks, we get told that's not the right treatment. So there is a lot of evidence for using long-term antibiotics. Let's skip this. This is an article I found where 296 patients of rheumatologists were surveyed, and they were antibody positive for Bartonella, but 46% had Lyme disease, which is spelled wrong there. 20% had a diagnosis of arthritis, almost 20% chronic fatigue, and 6% fibromyalgia. So we know those entities all morph into each other from Lyme disease. So I had an interesting case about 6 months ago. An 18-year-old female came in, and she had a tick bite, EM rash, was treated with Doxy, and had an increase in aching and fatigue. Then she had the onset a year later of vertigo, and she had orthostatic hypertension. Saw a pediatrician, got a Lyme test that was negative. He just said, go on your way. Saw a pediatric neurologist, April of 2013, saw ENT, wasn't sure of the diagnosis, pediatric infectious disease, told not Lyme disease. That's a Western blot, and co-infection testing was negative. She was treated with Zithromax and Ceftin, then Doxy and Tindamax, had an increase in cognitive problems. When I saw her, then she had a diagnosis of vertigo, fatigue, she had pain in her soles, shin pain, anxiety, air hunger. So when I first saw her, I diagnosed tick-borne disease, probable seronegative Bartonella and Babesia, treated her with Cetrin and Maluron, and then switched her to herbal regime after the antibiotics. And I last saw her March of this year, and she was doing fantastic, and she starts Johns Hopkins College in September. She was doing great. She said she was a new woman. Now, it's interesting. I got these slides from one of Dr. Burrascano's talks, and we were talking about it. Steer first found Lyme arthritis in 75, and Bergdorfer I found in 82, the spirochete. And then I think this is really interesting to the definition of Lyme, which is why we're in kind of a state. Steer diagnosed the major symptoms as Bell's palsy, cardiac symptoms, and arthritis. And he said the minor symptoms were fatigue, headache, neuropathy, cognitive dysfunction, and arthralgia. Well, he redefined success as elimination of the major syndrome, and the minor symptoms were classified as post-Lyme syndrome and shouldn't be treated with antibiotics. Well, as Joe said and Bernard said, 90% of the people I see are in that second category, fatigue, headaches, cognitive dysfunction. So I thought these two slides cleared up a lot about where we are with the diagnosis of Lyme. Then Holly Ahern is a microbiologist in the upstate New York area. She had a recent study where she found only half of respondents to her study were diagnosed with Lyme disease, reported a tick bite. About 33% of diagnosed respondents reported EM rash, and 50% of the diagnosed respondents had been treated with antibiotics, reported persistent symptoms that did not consider themselves cured. And she went on to give some of the reasons: misdiagnosis, lack of diagnosis due to the CDC's criteria for diagnosis, poor recognition and understanding of the signs and symptoms of disseminated Lyme disease by physicians, and reluctance of physicians to report cases. So I put this on just to show a pyramid of testing. It's been discussed adequately. I just had that there so people could kind of see that. This, Bernard talked about the Bartonella rash. I just wanted to give a picture. This is the serpiginous violaceous rash that looks like stress marks, but you see this in Bartonella patients. Okay, so you have Lyme disease, or you had Lyme disease. What next? My philosophy is in not only treating Lyme disease, but one's treating the patient with Lyme disease and their compensatory systemic imbalances caused by either Lyme disease or antecedent conditions. Now I go by what I call my wheel of function, and it comes from my acupuncture training, yin-yang. So on the top part, it's a little skewed, are the things that as organisms were affected by the Lyme infection, the co-infection, viruses that we've had, fungal infections, autoimmune, heavy metal, all the things that the body is trying to get rid of or affected by. And then there's your yin aspect, which is fatigue, neurotransmitter function, sleep disturbance, nutritional deficiencies, immune deficiencies, endocrine problems. So this is the yin aspect. So Joe put it very nicely. First, you're treating the multitude of things that are going on with the patient, and at the same time, you're looking how to support the function in all the different parameters. Again, how I look at this, instead of a disease model, is just this is Alzheimer's, this is headache, this is just Lyme disease. I look at it from this patient-oriented model, which I got from my functional medicine study. One is the genetics. So there's certain genetics, like HLA-DR4, we know that that's prone to arthritis. There's HLA testing, which is Shoemaker's work on neurotoxins, and I'll go into that. There's cytochrome P450 problems that people have. And there's different other enzymes like COMT, which is involved in neurotransmitters, etc. Then you have antecedents, which is total microbial load. You have allergies, you have toxins, which we'll go into later, mold, etc. Heavy metals, inflammation. Every person has a different thing that they contend with, so you're dealing with these antecedents. Then they get the trigger of a tick bite, they have Lyme, co-infections. Then they go into a balance where the body is trying to do the best it can. Hormonally, thyroid, adrenals, immune regulation, Th1, Th2 balance, neurotransmitters, mitochondrial function, as Joe said, inflammation, oxidative stress, and this manifests in the signs and symptoms. So the signs and symptoms in functional medicine lead us to what's going on in the person for their particular set of circumstances, which is all individual, and the lab tests are trying to delineate what's going on. So that gets us to functional medicine, which is really the dynamic approach to assessing, preventing, and treating complex chronic disease. Functional medicine helps clinicians identify and ameliorate dysfunction in the physiology and biochemistry of the body as a primary method of improved patient health. These functions often for each of us are the result of lifelong interactions among our environment, lifestyle, and genetics. Edison said the doctor of the future will give no medicine but will interest his patients in the care of the human frame, in diet, and in the cause and prevention of disease. Osler said the good physician treats the disease, the great physician treats the patient who has the disease. Now, when you look at functional medicine, you're looking at the roots and the branches. So the leaves, in this case, at the end of the branches, are pulmonary problems, or endocrine problems, gastroenterology, so where you make specific disease diagnosis. What happens as you get down, you get a look into the physiology processes, communication in the cell, mitochondrial function, bioenergetic balance, dealing with elimination of waste, which is detox function. And then as you get down, you get to the experiences, attitudes, genetic predisposition, and the roots are psychosocial, social, physical trauma, environmental, which is really important, diet, nutrients, and xenobiotics, and microbes, etc. Holism. As applied to medicine, holism refers not only to the relational character of medical description and therapy, but to the scope of medical gaze. I love this concept because you have to look at the whole picture, what's going on, rather than our knowledge about diagnosis and treatment. What's going on. You talk to the patient, everything that's been said this morning. It's more important to know what sort of person has a disease than to know what sort of disease a person has. And still say anyone can find disease, it's the job of the physician to find health. I put a list of books that I think people might enjoy reading. Very good one called The Biology of Belief. This is a cell biologist who got into quantum physics. He just has a beautiful concept of what's going on cellularly. Beverly Rubik wrote a book, Life at the Edge of Science, which is really beautiful. Bioelectrical orthopedist Becker wrote on how electricity works in the body. Ashman is pretty much the dean of energy medicine. Between Heaven and Earth is a very good book on Chinese medicine. Travell, Kennedy's doctor, wrote Myofascial Pain and Dysfunction. And Brawley wrote Laboratory Evaluation in Molecular Medicine. And Sachs wrote on the Why Zebras Don't Get Pulses. So functional medicine, the science is there. And in studies, it's important always to match apples to apples. Like, for instance, when they did the HRT a study in the States, the Prempro study, they used synthetic hormones. They made all these observations, but they weren't using natural hormones. So this is, comes out to be erroneous. You have to look in terms of functional medicine in the role of chronic symptoms, inflammation, nutritional deficiencies, toxicities, to name a few. And important thing in functional medicine is how now epigenetics, probably discovered in the last 5 to 10 years, but how our diet, proteins, inflammation are affecting the expression of genes and then affecting our health. And when I went to medical school, the genes were the genes, that's it. They weren't affected. And now we're finding that your environment is shaping our function and our health. And specialty medicine is really great. It's needed. The amount of information in specialties is too much for anybody. But we have to start not looking at just the answers, but we have to look in being in the question. So if we don't know something, it's not that it doesn't exist. It means we're looking into what can help our patients from something that we don't know. So health isn't just the absence of disease. And one disease, one medicine, I think, is an old paradigm. We're looking in our patients towards optimal health. That's what they're coming to us for. And I look at it as macro and micro. Like Western medicine is really hitting the macro. And what my job is to look at the micro to help the patient out with all those little things. Acute versus chronic. When you're in the ICU, you need Western medicine. It's the best. Chronic, Western medicine isn't hitting it. We're leaving the patient in front of us. A lot of specialists see the patient and say, you don't have Lyme disease. What is it? I don't know. Go see the other specialists. And pharmaceutical medicine versus nutritional and integrated medicine as a way of improving someone's health rather than suppression of symptoms. And this is just a piece on dysregulation. I'm not going to read it. You can just read it faster than I can say it. And so, how do you assess? So in my office, I use something called metabolic clearance screen. It's a Cornell Medical Center form, which is a global assessment of your system. And then I use something called Bioimpedance. I'm not going to go over the other two. So the metabolic clearing is basically just a questionnaire, almost like your SS36, where you just get to look at the patient globally. And so a normal patient who comes in for just a preventative workup should have a score of 25. I see people who have 170. So when I see them, in addition to tick-borne disease diagnosis, their body, they're just having problems with every system. So is it just Lyme? Is it just tick co-infections? Or is it, just a multitude of problems that are built up? And so one of the things I use is impedance. And you measure, the body mass index with this, but you also get a measurement of the phase angle and also the extracellular water. This is an article by Picaro. And this is another article which says that the bioimpedance is a good measure of body composition, and the phase angle can be considered a global marker of health and is also used to evaluate cell membrane function. And it's very simple. It's a good view into the metabolic state. It measures resistivity and reactivity, which then translate into those parameters, and can be used to initiate treatment choices and also for follow-up. Okay, so here you get the BMI, which in this patient is 19.33, phase angle, which should be over 7. I sometimes see Lyme patients that have 3.5, which means their cells are sick. So when you besides getting rid of the infection, you may have to do nutritional things to build up their body. And the total body water should be 60-40, 60% of water in the cells. I see people who have 50, 51%, so they're definitely overloaded, lymph system, extracellular compartment. And in my acupuncture, I see people who are excess or toxic, who are weak, ready to fall over. And the really troublesome person is the person who's toxic and weak, because if you see them and you start antibiotics, those are the people that will call you and say, "Are you crazy? I'm dying," So. And then I often look at someone as a vesicle. For a vesicle, we go through life, we want to hold the water in our vesicle, a half or 2/3, and have the ability to grow and transform. And we all take in air, water, nutrients, but we also take in chemicals and pollution, and then we try and get rid of it. And if you look at all the stratifications, you have nutritional glitches, you have allergies, you have hormonal problems, problem detoxification, as Joe mentioned a little too, infection, psychospiritual, sympathetic, parasympathetic, sleep problems. And what happens is, if you take this in your history, and then you'll see the patient, and they'll be overflowing when they have that global MCS is really high, and if they're overflowing in the front of their can, they have headaches. If they're overflowing in the middle, they have GI problems. Women have menstrual problems, cardiac problems, neuropsych problems. And so rather than go after the overflow, you treat them from a global sense. You also treat them symptomatically because you don't want them walking out not sleeping, etc. So integrative medicine is not just treating the symptoms, not just adding modalities. It's a new paradigm. You've got to shift the context. I like this quote: "You can study medical texts for 10 years and find no such patient in the clinic. You can work in the clinic for 10 years and find no such patient in any medical book." So how do you tell if a Lyme patients need more antibiotics or detoxification? So they're not getting better on the antibiotics. So either you have to do something, do their diet, stop the antibiotics, see how they re-equilibrate. They're having Herxheimer reactions. They have increased bowel symptoms from the antibiotics, from yeast. They have recurrent yeast infections. Different symptoms than they had with their Lyme. Maybe they have Babesia, maybe they have Bartonella. And then you do functional testing, organic acids, which can pick up mitochondrial problems, dysbiosis, complete digestive stool analysis to see how their gut is functionally, not just structurally, and then heavy metal assessment. So this is an interesting article on the effects of detoxification. It shows that moving toxins is an integral part of Ayurvedic, yoga, and naturopathic medicine. In this study, they took 25 subjects and were given the metabolic screening questionnaire. They were placed on a 7-day detoxification program, and the results were 47% reduction in the questionnaire scores and 23% increase in liver detoxification on functional testing. The conclusion was that the impairment in liver detoxification is consistent with the hypothesis that improved liver detox capacity can contribute to increased well-being. So the concepts of total toxic load is really important. Like, we're in a world that's getting more and more toxic. And the accumulation of toxic exposure minus the ability to detoxify, excrete, and eliminate toxins. Chemicals, pollutants, you could just read that. Mold toxins, which we'll talk about. Endogenous, even stress hormones can go through the detox pathways. and heavy metals becoming more and more of a problem, and microbes and neurotoxins. So toxic metals are, they're in, they're ubiquitous. They're in our drinking water, they're in foods, they're in amalgams in our teeth, they're in pesticides, they're in treated wood. And they bind with sulfhydryl groups in protein and inhibit enzyme systems. So you get dysfunction just when they're around, or if you have multiple metals, they can be synergistic. And they accumulate in organs such as the brain, the kidney, liver, bone, etc. And the mechanisms, I can go off and you can read them. I'm not going to go over all of the book. Let me go back. But they affect the gut, they affect the immune system, they affect the autonomic nervous system. They have a web-like effect. They have a synergistic effect where they each interact between each other. They affect metabolic pathways, cause oxidative stress, affect mitochondrial function, endocrine disruption, effects on insulin, inflammation, and in general cause physiologic dysregulation, which if we're not aware of, it's going to contribute to our Lyme patients' dysfunction. Here's a picture of how toxins get in the system and how they get broken down and then excreted. So first they go through the P450 system, which takes lipid-soluble products and converts it to conjugation and to make it water-soluble. And the thing with detoxification, if it's not going along smoothly, you create ROSs, intermediary, and that can cause problems. And this is another picture which shows the different nutrients in certain functional foods that if you want to simply detox these people, you put them on those, and they contain sulfur compounds, cysteine, they have antioxidants like glutathione, a really, really important antioxidant, CoQ10, minerals like zinc, manganese, selenium. And then I'm just showing this because the different systems like the cytochrome 3A4 has certain substrates, and the certain things we use in every day, like bioxidant, like rifampin, can either inhibit the way this gets broken down, which will create more of the substance around, or induce enzymes like rifampin, notoriously makes other things that you take less. Like in other words, if you have Necron with rifampin, you're probably going to need more Necron than the normal dose because it's inducing enzymes. So what do you do with assessment? Obviously, we talk to the patient, get the symptoms and the history. I do the metabolic screen. I do bioimpedance. I do acupuncture testing in my office. Energetic assessment, which we won't even go into, maybe a little at the end. And, of course, laboratory assessment that's been talked about. So you could do GI studies, which again is the comprehensive digestive, looking for dysbiosis, candida, organic acids, mold testing, heavy metal testing, chemical testing, and assessment of biotoxins through neuropeptides, which can show a certain picture in the body. VCS is called the visual contrast sensitivity. This is the work of Shoemaker, where he finds that these toxins affect the optic nerve and cause perceptual problems, which you can find on a test, and HLA testing, which I'll show you briefly. Medical detoxification, it can be GI-based, it can be liver detox, like the phase 1, phase 2, antioxidant support to prevent that intermediary increase in ROSs, herbal detox, hormonal, homeopathic, heavy metal detox, far infrared saunas used by more and more people to detox the body because you're getting rid of volatile compounds and chemicals, and chelation for heavy metals. Treatment is, again, perform a detailed monitoring of potential exposures, find the organ that seems to be affected by the detoxification, the pathway of excretion depending on the toxicant, and basically one of the best things in all people is just avoid the chemicals in the diet and the environment to just decrease the load, just like we want to decrease the infection and the microbial load with antibiotics. We want to do this with chemicals. Optimize nutritional status. Glutathione, also important, very important antioxidant and detox molecule. Functional foods, sauna for sweating, exercise obviously, chelation, intravenous vitamin C and IV glutathione are very good at detoxing. Cholestyramine, which we'll talk about, that's a resin cholesterol medicine that absorbs Lyme toxins and mold toxins. And again, that's the work of Shoemaker. Certain herbs, curcumin, allicin, chlorella, also good for detox, and herbals and homeopathics and fiber. So this article I got from the critical literature. It's about vitamin C affecting endothelial-dependent pathophysiology. And vitamin C enhances the activation of NOS, inhibits the action of pro-inflammatory lipids, restores endothelial functionality and sepsis. And I find that some of these processes that are going on in the ICU are what happen on a mini level when people are going through HERC. So if someone's going through a really bad flare, I have them come in the office for IV vitamin C and they feel much better because you're interrupting that pro-inflammatory state that's been set up. Okay, an article on mixed mold mycotoxicosis. This study at a multi-center showed multiple health complaints in patients with confirmed exposure to molds, increased neurological inflammatory symptoms compared to controls, abnormally high levels of ANA, anti-smooth muscle antibodies, CNS myelin, and peripheral nervous system myelin antibodies, increased pulmonary effects, allergy, and autoimmune, and their conclusion was mold exposure initiates an inflammatory response. Now this is a little diagram on Shoemaker's protocol because he finds that mold toxins and Lyme toxins start this Detox pathway which affects the body in many ways, and what happens is it affects the hypothalamus, causes decrease in certain products like MSH, which is important in defenses, and affects the system with the immune system. And some of the markers are C4A, C3A, MMP9, VIP, and TGF-beta. And mold disease and Lyme disease, mold produces neurotoxins, Lyme has neurotoxins. It causes inflammatory biotoxin reaction. The inflammatory cytokines activate genes, and this increases the inflammation. And certain HLA genetic types are prone to have decreased detoxification and increased inflammatory products. So when you do this genetic testing, which the labs in the U.S. do, Quest, LabCorp, you'll get certain HLAs like a 16.5 or a 15.6, which notoriously do not detoxify Lyme. So once you know that, you could then, in addition to treating them with antibiotics, you then give them things like cholestyramine. The cholestyramine can really cause a HERC, so you have to give them like a large amount of omega-3 beforehand to downregulate the inflammation. 11,352B and 4,353 are prone to increased inflammation and difficult problems in treating. So what do? You check the VCS and you can follow up, a couple of month interview. You give cholestyramine, you give the omega-3 like I just said, put them on sugar-free, gluten-free, detox procedures including far infrared sauna. Heavy metals have an effect on the nervous system, the immunologic system, vitamin D regulation, reproduction. Mercury has an effect on neurotoxins. It's a neurotoxin, has effects on the immune system, kidneys, GI tract. Heavy metal testing. You can do venous blood tests for heavy metals. You can do delta aminoglobulinic acid, the lead, red blood cell minerals, urinary minerals. Elevated uroprotoporphins can signify heavy metal toxicity. And provocational testing in the urine, where you give them chelating agents, DMSA, DNPS, and EDTA, which pull out metals. And so if you do a urinary metal and you get a certain amount, and then you give them DMSA and you take a 6-hour urine, you just see a 4 or 5-fold increase in what comes out. You then know there's heavy metal burden there. What?
3 minutes.
Oh. Okay. So heavy metal chelation, they bind metal ions. You try and get rid of them. There's natural chelators, and you always have to observe their other mineral status. If you're chelating them and taking out heavy metals, you always got to watch to make sure trace minerals, calcium, magnesium, are not depleted. Okay, so vitamin genes, sulfur-containing amino acids, glutathione, like I said, help. This is an article on curcumin and heavy metal toxicity. So Lyme disease dietary guidelines: watching caloric intake, low carbohydrate diet, low glycemic diet. Food, you always got to be aware of food allergies because they can really create a lot of symptoms like Lyme disease. Fatty acids, gluten sensitivity, mineral status, vitamin status, amino acid and protein status, and caffeine and avoidance of alcohol. Essential fatty acid deficiency, I just put the symptoms down there, we'll just bypass that, sorry. But fats are important in energy production, structure of cell membranes, basis of hormones, and modulate inflammation because they're the basis of the prostaglandins. This is probably too much to go into, it's 30 minutes. Testing, some of the tests, 2-hour postprandial insulin to see if they're insulin resistance. Food testing, like I said, essential fatty acid testing, red blood cell minerals, amino acid testing, organic acid testing. Top line supplements I use, and this changes a lot. It's also crammed, some of them have 2 because I couldn't fit it all in. Probiotic for sure, CoQ10, multivitamin mineral, magnesium, glutathione, rhodiola for the adrenals, transfer factor for the immune system, and herbally, cemento, Japanese knotweed is one that I really like. And so this is an article, you could read it, I'm not going to go over all that. Glutathione and how it affects the neuroimmune axis. Okay, so summary: clinical assessment, labs, tick-borne testing, antibiotic treatment, herbal treatment, treat the immune system, treat the HPA axis, balanced neurotransmitters, functional assessment, detoxification, treat the gut, probiotics, dietary lifestyle changes, targeted nutritional treatment, and energetic is beyond this. Thank you.